Good morning, everybody. It's Dr. Shenker here at the Cosmetic Surgery Clinic. It's a special day today. It's a day in the life. You get a sneak peek at how we do things here at the Cosmetic Surgery Clinic. These are the first dozen of the hundreds of stairs we're going to walk today in this building. So right now, the staff is all doing their thing, getting ready for the day. Ange and Patty are in the operating room setting up for surgery. Front desk is hard at work already. Jen is hard at work already. My job is to make breakfast, make sure everybody has a good day. So today it's waffles. Here we go. So you guys know in surgery, keeping neat and tidy is really important. So no cooking happens without my special apron. This is the apron that the team gave me holiday season last year. You can have a quick look at what that says. If I don't get my coffee, nobody wants to work with me in the morning. Before we start cooking every morning, always a good hand wash. Surgeons love washing their hands. It makes us feel excited for the day. Always before I start baking breakfast. Okay, time to eat. Let's get the team up here. Hey, it's breakfast time. Gather the crew. Okay, bye-bye. All right, where are we at, folks? Are we ready? Guys, grab a plate. Let's get breakfast going. Get our day going. Okay, folks, breakfast is done. Everybody's happy. Time to operate. Into the washroom, change into scrubs, and off to work. Ta-da! Into the scrubs, which I sometimes lovingly refer to as my surgery pajamas. Off to the operating room. Okay guys, we're gonna do our checklist, surgical safety checklist. So this is Janet. Janet is having a bilateral breast augmentation. That's a standard approach. Inframemory fold, submuscular. We're going somewhere between, let's say 295 and 325. We have sizers. You have no allergies to anything, correct?
No.
And we've taken your photos and you signed your consent forms.
Yes.
You had no questions you wanted me to answer for you. And we've done our special testing, pregnancy testing. She flunked, that's great. She's marked and I am happy and ready to go. It's actually the first thing I learned when I was a medical student in surgery. The first thing you learn is how to scrub. The second thing you learn is how to put on a gown. So these are the tools of the trade. Sterile latex gloves, sometimes not latex if the patient has allergies. Waterproof gown, so there's a barrier between myself and the patient. And standardized tools that we use in most cases. Okay, we're gonna take a little tour through some of our most common instruments. These are scalpels. This is a scalpel handle and a scalpel blade. This is just a scalpel handle. These are called precision handles. They're round and they're really nice to handle for making very precise incisions. Tissue handling forceps. These are called Adson Browns. These are called, no, I'm lying. These are called Adsons. These are called Adson Browns. They're my favorite for handling tissue and handling the sutures. These are the scissors that we cut with most of the time when we're cutting stitches. These are called iris scissors. They're great. This is what we use to put stitches in. It's called a needle driver, and it holds on to the stitch, and we place it precisely. This is an implant. This is a breast implant. This is a smooth, round silicone gel implant. We use these the overwhelming majority of the time. There are other types of implants, but this is what we use most of the time. As you can see, it's nice and soft and squishy, and it feels very natural when it's in the breast. And that's kind of how we get things done. Okay, surgery's all done, everything went great. It is time to go have a quick rehydration break, a little snack, and then off to see some consults. Let's go. So another part of the daily life here is signing prescriptions for our patients. When patients have surgery here, they don't have to be bothered by going to pick up their prescriptions in advance. We take care of everything here. We sign their prescriptions, we send them off to the pharmacy. We have everything waiting for you in a little bag on the day of surgery, so life is easy. So we're gonna sign a bunch now. Victoria, hey, how you doing? Rob Shenker, nice to meet you. What we're gonna do is we're gonna just spend a couple of minutes going through a bit of medical history. I'll get to know you a little bit. You'll tell me about some of, or if any, medical issues. You'll tell me why you're here and what you hope to get out of all of this. Then I'll step out for a moment, I'll let you change and I'll examine you, I'll do a few measurements.
and we can make a plan from there and see where we end up, okay? Okay, so it's late in the day. We've had a big day. We had team meeting, we had breakfast, we operated all day, we've seen a couple of consults. Last thing I usually do at the end of the day is just go around, talk to the team, see if there's anything outstanding that needs attention before heading off for home for the day. So, front desk, Tina, Laura, how's it going?
Great.
Any issues? Everybody happy today? Brilliant. Have a good night. See you guys tomorrow. One of the other great things about being enmeshed in the community here is that I get to relate to some of the other healthcare professionals around, and the timing is actually quite fortunate. Just now, we just missed a nursing student who dropped off a little gift for us. I usually give a yearly lecture to the local nursing college for their group of students that are in the peri-operative course. They're learning to be nurses in the operating room. And so I did that a little while ago. And when I do that, I usually invite those nurses to come and spend a day with us. And a lovely young nurse named Sarah came and spent the day with us here to observe how we do things and how surgical life is outside of a hospital setting. And we just missed her, but she just brought us a nice little gift. And it's nice when people get to know you really well, because she brought me the two things I love most in the world. One is espresso, and the other, of course, is chocolate. So thank you very much, Sarah. We love working with the nurses in the community. It's a real pleasure for us. Okay, that's it for the day. It's been awesome. We had breakfast, we had a team meeting, we operated, we saw consults, we checked in with the whole staff, we got a beautiful thank you gift from a local nurse that we worked with. Now it is time to head home, walk the dog, ride the bike, see my kids, see my wife, and get ready for tomorrow. Thanks for joining us. See you another day.